Hello, my name is Erin Rick, and today's lesson is about Generalized Anxiety Disorder, or GAD. You will learn about the disorder, its symptoms, some possible causes, and ways to differentiate teaching to benefit students who struggle with it. GAD is considered to be an emotional disturbance by the Individuals with Disabilities Education Act, IDEA, and is one of the named anxiety disorders in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. Before we begin, I'd like to test your prior knowledge on the topic by asking the question, does GAD affect each gender equally? Do females have the disorder more than males? Think about any students you've known personally who suffer from the disorder and whether they were male or female. According to the Anxiety and Depression Association of America, ADAA, and the DSM-5, females are twice as likely to be diagnosed with GAD than males, but that doesn't mean males do not have the disorder. A 2017 study suggests stigma may be a factor in adolescent males without diagnosis, as they were more likely to avoid treatment. About 3 to 5% of children have been diagnosed with GAD at any time, with girls being more prevalent. Generalized anxiety disorder is a widespread health concern for children that can have a negative impact on educational performance and may interfere with personal relationships. GAD manifests itself as hard to control worry about many aspects of a person's life. Children with GAD are often perfectionists who doubt their abilities and seek outside approval from others. Some students internalize symptoms of the disorder, making it difficult to recognize the reason for their struggles. Students with GAD should be taught in the least restrictive environment alongside their peers in a general education classroom with open communication and realistic expectations. The DSM-5 classifies GAD as excessive worry that lasts over a period of 6 months or more and is hard to control, with symptoms being present for more days than not. It is important to note that only one symptom needs to be present in children for a diagnosis to be made. Many children with GAD also suffer from other forms of anxiety, like separation anxiety. Some symptoms of GAD affect a student physically, manifesting as muscle aches, stomach aches, and headaches. Trembling, twitching, and shakiness are symptoms associated with muscular tension. Restlessness, insomnia, and fatigue, difficulty concentrating, and irritability are other symptoms expressed by students with GAD. Students deal with persistent and pervasive distress and can sometimes be very self-conscious. According to the DSM-5, only one symptom needs to be present in children to form a diagnosis. Anxiety disorders are the most common psychiatric illnesses experienced by children. A student with GAD may be intellectually able, but due to the symptoms may perform poorly in class and may not make friends easily. Some students with GAD also experience selective mutism due to anxiety. The exact cause of GAD is unknown, but experts indicate that it can be triggered by genetics, brain neurochemistry, and environmental stressors such as trauma or chronic illness. GAD often runs in families and may be hereditary. People with GAD have brain neurotransmitters that do not communicate properly with each other. A possible imbalance of serotonin, norepinephrine, and GABA prevents the brain from calming down the amygdala, the emotional center of the brain, which leads to a perpetual state of heightened alertness and anxiety. Experiencing trauma, including abuse and other stressors, may affect the way a student perceives threats. In some cases, anxiety may be caused by an underlying medical condition, such as an overactive thyroid or side effects of medications. IDEA does not have a standalone definition of GAD and instead recognizes it as an emotional disturbance which adversely affects a student's educational performance. The disorder must be present over a long period of time at a marked degree. A medical diagnosis of GAD does not guarantee a student will receive an IEP. The school's team must make the recommendation based on academic impact. They may still qualify for a 504 plan, however. Teaching a student with GAD requires a calm and predictable environment with routines and schedules. When the student knows what to expect, there is less anxiety. Other strategies include classroom accommodations, such as small groups and optimal seating. Allowing a student to work in groups may help the anxious student make connections with peers and reduce anxiety. Rather than being called on in a whole group setting, the student can interact with other students. A student with GAD may feel some relief if seated by the door or near a window. A classroom pass allows the student to leave when he or she feels anxious without having to ask, drawing attention to themselves. Testing accommodations can include extra time for completion, which may lessen the worry about taking a test. Alternative assignments, task chunking, and copies of notes may also be necessary for the student with GAD. Letting an anxious student know ahead of time that they will be called on can be helpful too. Allowing a student with GAD the opportunity to be creative may be helpful, such as letting them sketch their notes instead of writing them out or offering creative alternatives to assignments that may cause stress and worry. Positive coping skills have been very helpful for students with GAD. Other coping mechanisms like weighted stuffed animals and textured chairs have helped too. Teaching a student to name their feelings or recognize when symptoms begin, allowing them to write about their feelings, and giving them a moment or two to breathe deeply have all been shown to help lessen worry. You can teach your student these coping skills and allow them to check in with themselves when they feel anxious without calling attention to them. Encouraging them to write about their feelings is a good coping skill they can use once they notice symptoms beginning. Another intervention would be to allow the child time to see the school psychologist for multi-tiered support. The psychologist could counsel the child using cognitive behavioral therapy to reduce worry and improve social interactions if they are having trouble making friends. The psychologist can also help implement a 504 plan for students not eligible for an IEP. They also work closely with parents to ensure routines are followed at home too. Some resources for parents include websites like childmind.org and brainbalancecenters.com. But here in Baltimore, we have the National Alliance on Mental Illness, NAMI. NAMI provides education, support, and advocacy for people with mental illnesses and has local support groups. The ADAA website provides facts and statistics on anxiety disorders. Chase Brexton Healthcare provides therapy for children who may need it, and there are many locations in our area. Students with GAD can be taught in cohort with their peers and be just as successful with a few accommodations. Teaching a student with GAD requires patience and predictability. Routines are key for these students who may fear the unknown. If they don't know what to expect, they may feel anxious. A student with GAD can succeed in your classroom with just a few differentiations and a kind and patient attitude.